Good morning, everyone. Can you hear me well enough?
Yes.
All the way in the back there? Good. Okay. Well, thank you to the Macular Degeneration Association for having me speak here today. Happy to be with you guys this morning. So our first talk, we're going to talk a little bit about diabetes and how it affects the eye specifically. So first of all, let's review some of the basics. What is diabetes? Well, diabetes is a group of diseases that's characterized with high blood sugar levels, right? And this can result from several different reasons. One, the body may not produce enough insulin, which we call type 1 diabetes, or there's type 2 diabetes where the body doesn't process the insulin well. So those are basically the two types of diabetes that we have. The majority of people nowadays have what we call the type 2 diabetes. This is a very common disease. 26 million people in the United States are affected by diabetes. There are many more that are undiagnosed just because of lack of awareness or lack of access to care. 57 million people are in this category that they call pre-diabetic, where they may have some high blood sugar levels, but their doctor hasn't started them on medication, but they're considered very close to being diabetic. So a lot of these folks can, over the next few years, turn into diabetics. If we look at the population over the age of 65, 1 in 5 people are diabetic. So again, very common. And they're predicting that since people born after the year of 2000, 1 in 3 people will develop diabetes throughout their lives. So you can see that this is a very significant disease that affects a lot of people, have a significant impact on the healthcare industry in terms of costs also. So currently they say about $132 billion annually are spent on care related to diabetes. So that's a very significant impact on our healthcare. If we look at retinopathy, diabetic retinopathy, and that's the disease that affects the eye from diabetes, it is the leading cause of blindness in people in the working age in the industrialized countries. There's about 1.8 million cases worldwide of blindness due to diabetes. If you're diabetic, you are 25 times more likely to go blind than someone who's not diabetic. So you can see that there's a significant risk to your eye and your vision as a result of being a diabetic. So how do you know if you are diabetic whether or not you're going to develop the eye disease or the retinopathy? Well, the best predictor is how long have you been diabetic. The longer you've been diabetic, the greater chance there is that you're going to develop effects on the eyes or retinopathy. After 20 years, almost every single type 1 diabetic develops some form of retinopathy. That may be mild or it may be very severe to the point where they've actually lost vision, but they have some form of retinopathy. And those who are type 2, about 3 out of 5 people after 20 years will have developed some form of retinopathy. If we look at all diabetics across the board, about 1/3 of all diabetics have some sort of retinopathy. So again, a lot of people have diabetes and a lot of people have effects on the eyes as a result of diabetes. So what can it do to your vision? Well, it can be very mild and have really no effect on your vision. It can cause your vision just to overall be blurry. You might see floaters, red spots in your vision. You might have trouble focusing or reading. And in the very late stages, sometimes you can develop a very painful red eye. So there's a range of ways that it may affect your vision. So what is diabetic retinopathy specifically? What happens in the eye and the retina to cause loss of vision or blindness? Well, it's a disease of small blood vessels, and these small blood vessels are all throughout our body. In the eye, the effect is very significant because obviously it's your vision that we're worried about. So you develop problems at the level of the very small blood vessels, and these small blood vessels start to turn abnormal, and then they start to leak fluid and start to bleed into the retina. And as a result, there's not enough nutrients and oxygen due to this small vessel problems, and the eye says, I need more oxygen, I need more blood, and abnormal blood vessels start to grow into the eye. And so that's how we see the effects of diabetes in the eye. So there are different stages of diabetic retinopathy. From the very beginning, the mild preclinical changes, which we call background diabetic retinopathy. And then as we progress further, there were more advanced stages, which we'll go into a little bit more detail. And any of these at any stage can cause some degree of vision loss. So we classify diabetic retinopathy into non-proliferative, which means that there's no new blood vessels, or proliferative, which means that there are new blood vessels growing into the eye. And remember, these blood vessels are abnormal, and that's the problem, is that we don't want these abnormal blood vessels growing in the eye. And then there's an entity called clinically significant macular edema or diabetic macular edema. And macular edema refers to swelling in the retina. And the macula, as we'll hear over and over today, just refers to the very center portion of your retina. So the very most important central part of your retina is referred to as the macula. And when there's edema, that means there's swelling. And if you can imagine, if the center part of your retina is swollen, you're not going to necessarily be able to see very well. So that's how macular edema affects your vision. And that is one of the leading causes of vision loss is as a result of diabetes. In very advanced stage, there's something called attractional retinal detachment. So you can actually develop a retinal detachment as a result of diabetic retinopathy. And that's a very advanced stage in which surgery may be necessary to fix the problem. So when we look into the eye, so the non-proliferative, this is the earliest stage that I was describing, there are several different features. And if you're not familiar, this is an image of retina. This is looking into the eye. This is your optic nerve. These are your blood vessels. And as I was mentioning, the macula, this is the very center part of your retina right here that we're referring to. So in diabetes, you see all these red spots. Those are hemorrhages or little spots of blood that have developed in the retina. You can get little cotton wool spots, and cotton wool spots are just little areas of loss of blood flow to the nerve tissue of the retina. You can get aneurysms. You can get swelling in the center. Again, that's diabetic macular edema, and we'll come back to that later. So some of the details I'll kind of skip over, but and so let's get to diabetic macular edema. So I was saying that this again is swelling in the very center part of the retina. You see all these little yellow spots. In this case, in diabetic macular edema, and this is very different from macular degeneration, which we'll talk about later, these yellow spots are actually protein deposits. They're not the drusen that we see in macular degeneration, even though they can sometimes look very similar. And here's some images of diabetic retinopathy with macular edema, and this is a scan of the retina called an OCT, and I'll show you more details about those with our macular degeneration talk. But that basically shows us that there's swelling in the retina through a cross-section. It's kind of like a CT scan of your retina. And here's some more examples that show us what swelling in the center part of the retina looks like on these OCTs, and your doctor may show you these pictures to say, this is what it looks like, and if you get treatment, we can use these images to track your progress and response to any treatments that you may need. We mentioned the proliferative diabetic retinopathy, and this is, again, a more severe form of diabetic retinopathy. This is when new blood vessels start to grow in the eye. And if you can see here, if you remember the previous picture that we saw, compare that to this looks a lot more abnormal. These blood vessels are very abnormal here. Those shouldn't be there. Those are new blood vessels growing into the eye. And you can imagine those blood vessels are very fragile and delicate, and any tension on them can cause them to bleed. And there's a lot of additional bleeding up here and changes in the blood vessels that are very indicative of an advanced stage of diabetic retinopathy. A vitreous hemorrhage, so this is a big bleed into the center part of the eye. And you can see here there's a large blood clot here covering the center part of the eye, as you can see here also. So that can obviously obstruct your vision, and if you have bleeding into the eye, that may require surgery to remove the blood. Another advanced stage of diabetic retinopathy is something called rubiosis iridis, or neovascular glaucoma. This is when those abnormal blood vessels actually start to grow in the front part of the eye, and they block the normal drainage pathways of the eye, which causes the eye pressure to go up. And that eye pressure going up is a type of glaucoma, which can lead to irreversible loss of vision based on optic nerve damage. And so this typically has very poor prognosis for vision recovery. And I mentioned the tractional retinal detachment, a type of retinal detachment that occurs, and This again can require surgery. You can see here the retina is lifted up off of its normal position because of scar tissue that's formed from those abnormal blood vessels. And that may require surgery to fix that, as I mentioned. So, treatment for diabetic retinopathy. Well, it actually starts before the retinopathy develops, and that's to try to actually treat the diabetes itself. So, prevention is by far the most important aspect of treating diabetes. Keeping those blood sugars under control, keeping your blood pressure under control, trying to eliminate any fluctuations in blood sugar, that is the most important thing in trying to prevent retinopathy from developing to begin with. And then if you are diagnosed with diabetes, making sure you get regular examinations for screening purposes, and then depending on the amount of lack of disease or amount of disease that you may have, following your doctor's recommendations for continued follow-up and care. For type 1 diabetics, the screening exam, the first exam that you have, should be done within 5 years of the diagnosis, and then once a year thereafter. If you're a type 2 diabetic, you should have your first exam as soon as you are diagnosed with the disease. And then if there's no other problems, then just once a year. If you do have any problems, then it may be more frequently, depending on your doctor's recommendation. Another situation which may affect folks with diabetes is pregnancy. And during pregnancy, the situation's a little bit different, but we won't get into details of that. So what are the different treatments that we have available for the different stages of diabetic retinopathy? Well, again, if things are very early stages and there's very mild disease, you may not need any treatment, which is good news. However, the fact that you may see some changes in the retina or in the eyes is indicative that the blood sugars are probably not well enough controlled, and your doctor may say, you need to work on your blood sugar control and your blood pressure control. Come back in 6 months and I want to see some improvement. Otherwise, we need to talk to your primary care doctor and have them adjust your medications or do something to help control your blood sugars better. Now, the more advanced stages that we talked about, the proliferative stages, now this necessitates treatment. You should have treatment if you develop abnormal blood vessels growing into the eye. And what are some of the treatments that we have that we can use to try to prevent these blood vessels from causing additional problems? Well, we have laser treatment, and the laser treatment is to try to get those blood vessels to shrink away. There are medications that we inject into the eye, and this is very similar to what we do for macular degeneration. It's actually the same medications that we use also. And those medications stop the drive for new blood vessel growth into the eye. And ultimately, the type of surgery that we were talking about is called a vitrectomy surgery, and that's a retinal surgery that may be needed if you have more advanced stages. So those are the different treatments for the advanced proliferative stage. This is an example of an eye that's had laser treatment. You can see all these white spots in the outer part of the retina, and those are scars that are delivered by the laser treatment. And that, again, that laser treatment is to try to, it actually kills part of the retina that's producing the signal to grow those abnormal blood vessels. So that laser treatment has been around for many years and is very effective in slowing the growth of abnormal blood vessels in the eye. This is what the surgery looks like if one is to need more advanced retinal surgery. We actually go inside of the eye through small incisions that are made in the white part of the eye, and then we look through the very center part of the eye, through the pupil, and we're able to look through a microscope and see into the back of the eye. This is kind of like laparoscopic surgery. So we have one port that keeps the eye inflated, and then the other two that we use for our instrumentation. And we're able to manipulate and control things in the back of the eye through that type of surgery. For diabetic macular edema, again, this, as I mentioned, is one of the leading causes of vision loss in diabetics. There are several treatments available for this also. Laser treatment has been around for many years and is very effective. And that type of laser treatment is different than the one we discussed earlier. In this case, the doctor may look at all the little aneurysms in the center part of your retina and try to target those individually with laser to try to stop them from continuing to leak fluid into the retina. Nowadays, the more effective treatment and the first-line treatment that we found are those medications that we inject into the eye. Again, the medications they're almost like an anti-inflammatory where they stop the leakage process and can reverse the macular edema. And this has been a very effective treatment that we now are able to reverse a lot of the changes in diabetes with these medications. Ultimately, if the diabetic macular edema is resistant to any of these types of treatments, then ultimately surgery may be employed for that also. So this is an example of the laser treatment that we talked about, targeting all those little aneurysms with the laser spots to try to stop them from leaking. A different type of laser, it's called a micropulse laser, and this one is less destructive to the retina and just kind of tickles the retina to try to stop it from leaking. The injections, and are most of you familiar with the injections? You've all heard about getting the eye injections, yeah. So this is something that's done in the office. It's an office procedure, and it's a very fast, quick procedure. The way I do it, we numb up the eye. It takes about 10 minutes. Giving the injection is very fast. Takes about 5 minutes, or 5 seconds. So it's a very quick procedure done in the office. Most people actually can drive themselves home afterwards. So this has become a very common. I probably do 15 to 20 injections every day. So it's become very common type of procedure for not only diabetics, but again, macular degeneration, as we'll discuss later. There are different medications for diabetics that we use. Anti-VEGF is the mainstay, the medication that we were talking about earlier. Avastin, Lucentis, and Eylea are basically the three within that category that we use for treating diabetic macular edema. We also use steroid medications, and there are 2 steroid medications that are approved for macular edema, and these are the 2 steroids, and Ozurdex is one of them that's been around for about 5 years or so, and then Iluvien was just approved a couple years ago. These are interesting in that they consider them little implants. They slowly release medication over an extended period. The Ozurdex for about 3 to 4 months, and the Iluvien they say for maybe 2 to 3 years. And so that medication is slowly released over that time frame, and so you may not need repeated injections because the medication continues to work over that time frame. And these are given as injections in the office just like the other medications, but they're little pellets, so it stays in the eye for that time frame. And then I mentioned the other medications, the Eylea, Lucentis, and Avastin. If you ask retina specialists, they're all pretty equivalent in terms of how they work. There may be some advantage, we think, for some of for the diabetics, for the Eylea and the Lucentis over the Avastin, but that's debatable. So they're all effective. So if you're getting one versus the other, and your doctor may change the therapy at some point also, but we think in general they're all probably fairly equivalent. And this is again an example of surgery reserved for very advanced cases. So what can we expect in the future as far as treatment for diabetes? Well, a lot of the ongoing research in terms of new treatments is centered around new medications. So can we find better medications? Can we find better ways of delivering those medications? You saw the implant, so they found a way to release medication over an extended period. Well, are there other ways of delivering some of these other medications over extended periods that may not require you to get ongoing injections, say every month or every other month as it may be, reducing the burden of office visits and number of times you have to get a needle stuck in the eye. But a lot of the research is centered around new medications. There's a lot of investigation going on, a lot of active research. This is a very active area, trying to find the best medications to try to slow down this process. But just to reiterate, once it gets to the point of having eye disease, we can certainly do things to treat the eye disease. But the most important thing starts before that, before the eye disease even begins, in controlling the underlying blood sugars and diabetes and high blood pressure. So with that, I will conclude this section.